Hi, my name is Emily, and in this video I will explain to you the benefits of applied behavior analysis, also known as ABA, and I will also talk about discrete trial instruction, which is known as DTI. If you look this up to research, sometimes it will come up as DTT, which is discrete trial training. So children with autism struggle daily with behaviors that can affect their life. Some of these behaviors include inappropriate social interaction, poor eye contact, compulsive behaviors, impulsivity, self-harm, intense interest in a limited number of things, problems paying attention, unaware of others' emotions, and/or depression, among many other problems. ABA and DTI therapy takes each individual child and focuses on goals to improve these behaviors through a system of rewards and consequences. It is important to note that you cannot look at a child's behavior and assume how to fix it. An individual's behavior is determined by their environment, their learning history, and their psychological makeup. These three things play a huge part in behaviors. You cannot just look at the moment the behavior occurred. ABA and DTI takes these three things and uses that during therapy. Before I begin to talk about these two things, I want to discuss the difference between the two because people tend to confuse ABA and DTI. DTI is a strategy found under the Applied Behavior Analysis umbrella. It is a technique used in the larger field of behavior analysis, whereas ABA is a field of study that uses modification in certain environments. For example, DTI involves teaching a child to attend to specific environmental cues, whereas ABA involves a very broad range of environmental conditions that produces the highest level of success. So ABA is defined as the practice of applying the psychological principles of learning theory in a systematic way to alter behavior. To simplify this means that applied behavior analysis studies behaviors and then modifies these behaviors occurring. This therapy technique changes the environment and monitors responses from the person to result in changed behavior or learning of life skills. It is especially useful in teaching behaviors to children with autism who do not otherwise pick up on these behaviors on their own as other children would. ABA teaches these skills through the use of careful behavioral observation and positive reinforcement or prompting to teach each step of a behavior. To begin ABA therapy, first it is important to analyze the behavior. To do this, the ABC model is often used. A stands for antecedent, which is a directive or request for the child to perform an action. B is the behavior, so a behavior or response from the child, successful performance, noncompliance, or no response. C is the consequence, which is the reaction from the therapist, which can range from strong positive reinforcement, like a treat or verbal praise, or a strong negative response, such as no. ABA methods are used to support persons with autism in 6 major ways. First, it increases behaviors. Reinforcement procedures increase on-task behavior or social interactions. Second, it teaches new skills, such as instruction, functional life skills, communication skills, and so on. Third, it maintains behaviors, teaching self-control and self-monitoring procedures to maintain and generalize job-related social skills. It generalizes or transfers behaviors from one situation or response to another. So, for example, completing assignments in the resource room to then performing as well in the mainstream classroom. It restricts or narrows conditions under which interfering behaviors occur, modifying the learning environment. And lastly, it reduces interfering behaviors such as self-injury. Over the past 40 years, thousands of published research studies have shown the effectiveness of ABA across a range of populations, so children and adults with mental illnesses, interventionists such as parents, teachers, and staff, settings such as schools, home, institutions, group homes, hospitals, businesses, offices, etc., and behaviors such as language, social, academic, leisure, and functional life skills, aggression, self-injury, oppositional, and stereotype behaviors. So as you can see, ABA is beneficial for all areas. There are different techniques used in this therapy, such as prompting, shaping, fading, differential reinforcement, chaining, tasks analysis, video modeling, and so on. Evidence has shown that applied behavior analysis is one of the most common and effective methods of therapy for individuals with autism. It helps correct a wide variety of difficulties such as social skills, verbal behaviors, reasoning skills, challenging behaviors, and so on. ABA is effective for children, teens, and adults as well. There are many positives to ABA, but one downfall is that it can be extremely exhausting for the child, as it involves intensive training on therapists, extensive time in applied behavioral analysis therapy. They spend 20 to 40 hours per week, and weekly supervision by experienced clinical supervisors known as certified behavior analysis. Although it can be exhausting, studies have shown that benefits improvements of this therapy. I myself have seen this firsthand. So I started working in Child Serve this summer in May, and I worked in the Autism Day Health Program, which is basically just a daycare for children with autism. So they spend their day there while their parents are at work, and we target goals as well as like social, language expressive, just a bunch of different stuff for children or for those children. And one of the main things that were targeted for these kids were social skills. And one boy specifically was getting ABA from one of the teachers. And when I started in May, he had a lot of tantrums. He had a lot of behaviors. He was unable to express what he wanted. He just threw himself on the ground. But by the time, so he started ABA in July, and come August, I noticed the difference in his behaviors. He went from a little boy who displayed horrible behavior issues, like I said, having tantrums and self-injurious behaviors, to displaying little to no behaviors by August. He was able to identify the issue and communicate with the teacher on what he wanted, and I give ABA that credit and the teacher who worked with him all day. So yes, it was extremely intensive therapy all day long, but it showed to be extremely beneficial super quick. So now I'll talk about discrete trial instruction, and that's a strategy used while applying ABA. It involves structuring a teaching opportunities so that when the child responds, a consequence is delivered with the goal of increasing correct responding. And it involves 4 components. The first is discriminative stimulus, which is the instruction given. The response, which is waiting for a response from the child. Consequence, providing feedback to allow the individual to learn. And then intertrial interval, which is a brief break. Discrete trial is often used as the starting point for behavioral treatment for children with autism, and then slowly other behavioral strategies are used during this treatment. The goal of DTI is that individuals should be able to perform the new skills with different people in multiple settings, in different situations, and with alternate or different instruction or cue. To sum this all up, oftentimes you hear the expression that if you've met one person with autism, then you've met one person with autism, meaning every case is different. The autism spectrum varies significantly for each person, and this should be kept in mind as ABA and DTI are applied. It needs to be individualized based on the person, as some strategies may not work for every person. Thanks for listening, and I hope you learned something.